Hi, I'm Dr. Jason Roostaeian. I'm a plastic surgeon here in Los Angeles, and I specialize in facial aesthetics, and I'm here to talk to you about rhinoplasty. I'm going to start with a brief overview, then I'm going to go into a little bit more detail and go over some of the modern techniques and technology that I've been involved with through my research. Then I want to try to help you decide if rhinoplasty is the right procedure for you. We'll look at some of the top questions that I get from my rhinoplasty patients. I'll have an opportunity to look at some of my before and afters, and we'll wrap it up with some main takeaways. So rhinoplasty is commonly referred to as nose job. Believe it or not, it's been around since 500 BC. In India, nasal mutilation was a form of punishment, and there was an Indian surgeon that was using the forehead skin to reconstruct the nose. We still do that procedure today when it's necessary. It's widely considered one of the most technically demanding and difficult procedures in plastic surgery. I think it really has to do with the fact that you have to worry about both form and function, the function being your nasal breathing. And then in terms of the form, every millimeter counts. The structure of the nose is very important to the end result, and we're literally sculpting it. Lastly, every nose is different, just like every face is different, and no rhinoplasty is the same. So we have to use different techniques, and there's a lot of artfulness to it that I find very gratifying. So rhinoplasty is the second most common procedure performed in the cosmetic surgery realm. There's over 220,000 procedures performed just last year, and a lot of the well-known celebrities have actually had rhinoplasty. So broad categories within rhinoplasty is cosmetic versus functional, is it open versus closed, and is it a primary versus secondary, and I'm going to talk about each of these now. So cosmetic rhinoplasty is strictly for the appearance of your nose. So you can feel like your nose is either too large or too small and just basically doesn't fit your face. Or is your nose crooked? Could have prior trauma, or were you born with a crooked nose? These are all potential reasons that people seek cosmetic rhinoplasty. When someone comes in for a cosmetic rhinoplasty consult, we always want to analyze the face, and that's what I'm showing here. These vertical lines basically break up the face into fifths. The width of your eye should roughly equal the width of your nose at your nostrils. So we want to analyze all this and decide what we need to do for your nose and or your face. These horizontal lines is another way we break up the face. From the brow to the eyebrow, then the eyebrow to the nose, and the nose to the chin. All these proportions should be roughly equal. And this comes in hand, for example, in this patient where her lower third was a little bit deficient here before the surgery, and we were able to simply put in a small implant and give her better facial proportions, and she was much happier with her profile view. So another patient that had a dorsal hump and was unhappy with her profile view, we're able to bring that down nicely for her without dramatically changing the appearance of her nose when she looked in the mirror on the frontal view. This is a male where he had a dorsal hump, he also had a drooping tip. We're able to straighten out that hump and get rid of the droopiness that he had in his nose. But it's very important to know in the male, we really try to avoid any scooping of the nose and also over-rotating the tip upwards. That feminizes the nose. He also had a crooked nose, was pointing to the right. We're able to straighten that out. He had trouble breathing. We're able to correct all of that for him. So functional rhinoplasty is really rhinoplasty to treat trouble breathing through your nose. This can be covered by insurance, and there's some common causes. You could be collapse of the internal external valve, and I'll go over what that is. It could be septal deviation, which is a very common reason, or inferior turbinate hypertrophy, which is probably just as common, but a less well-known entity. So I want to first show you the inferior turbinate hypertrophy. In this top slide, you can see what the inferior turbinate is. It's this mucosal outpouching on the lateral side of your nose. This is the view we get when we look at inside your nose inside the clinic. And you can see this serves an important function in your nose where it humidifies and also warms the air that you breathe. So we don't want to completely cut it out, but we want to downsize the bone of it here and thereby preserving its function without blocking your airway. Secondly, you have the nasal septum here. That's the cartilage in the middle of your nose, and that could be deviated. It could be C-shaped or S-shaped and block one or both of your nostrils. So we want to take a good look at that and also get rid of that deviated portion of your septum. Lastly, you have the external and internal valve. The external valve is right here at your nostril essentially, and when you take a breath in, some of my patients, it basically collapses and we need to support that with some cartilage. You also have the internal valve, which is further up in your nose in a junction between what's called the upper lateral cartilage and the lower lateral cartilage, and that's an area of constriction in terms of your breathing. Again, that area can collapse, so we put another piece of cartilage to help spread that airway open and let you breathe better. Here's an example of a patient who had all three of those issues. He had the turbinate hypertrophy, septal deviation, and both external and internal valve collapse. We're able to fix his septal deviation, get him straightened out, and also put support into his ala here so he didn't get that external and internal valve collapse. Now I want to talk to you about open versus closed rhinoplasty. Open rhinoplasty is called such because you're able to visualize everything, and you're able to do that by putting a small scar across that little skin bridge across your nose. Otherwise, all the incisions are inside your nose. And in closed rhinoplasty, all the incisions are only inside your nose. There's no scar there, and I'll show you a diagram of that. But basically, the main thing is that with open rhinoplasty, you're able to visualize the tip better. So anytime a patient needs a lot of tip work or wants a lot of modifications to their tip, I generally recommend an open rhinoplasty. Otherwise, we can accomplish most other maneuvers through a closed rhinoplasty, and I think that's a great approach as well. Here's an example of open versus closed. The diagram, again, you can see there's this small incision across that skin bridge, but everything else is inside the nose, versus closed where it's all inside the nose. But you can see here the open rhinoplasty allows you to peel that skin back and really get a good look at the tip. So I think that's an important point, and when it's necessary, it's the right procedure. Here's an example of a patient that had an open rhinoplasty. As you can see, it's a very difficult incision to see. Most of us don't walk around with our face headed up, and there's an old saying that only dog and lovers can see that incision. Here's another view of the same patient. Again, it's very difficult to see the incision. I just wanted to point that out. So now I'm going to talk about primary versus secondary rhinoplasty. So primary rhinoplasty is basically a patient that never had nose surgery before, versus secondary rhinoplasty, which is basically someone who did have prior nose surgery. So 5% of primary rhinoplasties end up needing a revision. And this brings unique challenges. You could have a lack of nasal cartilage, there can be excess scar tissue, and we often don't know what was done before. For that reason, we often recommend an open rhinoplasty approach so we can see what the pathology is, see what the deformity is, and address it. The other important point is that you often need cartilage from a separate source. While we were using the septum for all our primary rhinoplasties, we need to go to the ear or rib often for the secondary rhinoplasties, and it's important for you to be aware of that. So what are some of the more modern techniques? Initially, with rhinoplasty, people were just trying to downsize the nose and were basically downsizing and cutting away cartilage, which is your structural support for the nose. This would lead to issues like this called the inverted V deformity, where the upper lateral cartilages would collapse, and that's basically shown here. Now, these upper lateral cartilages, if we're able to preserve them and put them back in an anatomic position rather than just cut them down, then we're able to give people better shape and also better function for their nose. And this is shown in this patient from that research, where we were able to preserve her what's called the mid-vault area and maintain that while still addressing her dorsum, and able to cut down that area, but preserving that cartilage and putting it back in an anatomic way gave her the support and a very natural appearance. There's another modern technique that I've been involved with in my research. It's called using the ultrasonic bone aspirator, which is basically using ultrasound waves, a device that then uses those ultrasound waves to only cut the bone. It's not able to cut any of your soft tissue, and that basically means less bruising and less swelling because you injure less tissue. This then can translate into less downtime, and this is a new device I'm very excited about, and I think can basically makes the rhinoplasty a little less invasive and shortens your downtime, which I think is very important. Here's a patient from that study that we were able to downsize her nasal bones and get her a nice result with minimal downtime. Another patient from that study, again, able to bring down the nasal bones there on the profile view, and give her a nice result with minimal bruising. So when you're trying to decide whether rhinoplasty is the right procedure for you, where you need to start is whether you're in good health. Any elective procedure, you got to first be healthy for it. You want to be at least the age of around 16. For females, it could be a little less, and for males, it's a little bit older, but you want your nasal growth to be done. You don't want our result changing after it's done. Then it's just a moving target. Are you a non-smoker? That's a very important question because any smoker has dramatically higher risk of complication with rhinoplasty. The smoking blocks the small blood vessels in your nose and makes healing issues a lot more common. And we got to make sure that you stay away from any cigarettes or even secondhand smoke for at least 4 to 6 weeks before the procedure and after. Some good reasons to consider the procedure is your nose just does not seem to fit your face. It's out of proportion. Or did you have prior trauma or something since birth where your nose is malaligned or crooked? Lastly, you can have trouble breathing through your nose, and that's a good reason to consider rhinoplasty. So what are the most common questions I get from my rhinoplasty patients? How long does the procedure take? Now, again, just as every nose is different, just this surgery ends up taking a different amount of time. So that's something we could go over in your consultation, but I'd say in general, it's about 2 to 3 hours of operative time for any primary rhinoplasty. How much pain can you expect after the surgery? I'll say the overwhelming majority is that the patients always tell me that they're surprised how little pain they had. We always prescribe you narcotic pain medications, but often the patients say I only need to take it for a day, maximum 2, and I was good. What is the recovery time like in rhinoplasty? So the recovery time, the first week you're going to have your nasal bandages in, you're going to have some bruising, you're going to have some significant swelling. Swelling then slowly subsides. It takes about good 4 to 6 weeks until you feel like it's mostly gone, but really it still lingers for about 3 months, if not 6 months. But that last increment from after the 6 weeks is very minimal and barely noticeable. How much time should you take off work or school? Most of my patients like to take a week off of both. Now you'll be able to get work done at home, but most people don't want to walk around with their nasal bandages. When can you work out again? For the first 2 weeks, you want to keep your blood pressure and heart rate down so you don't cause any undue bleeding or excess bruising in that time period. Then I have people gently start exercising, but we want to make sure you don't do anything that's mechanically traumatic to all the work we put into your nose. So I really have people hold off from anything strenuous for at least about 4 to 6 weeks until everything's well healed enough. How much does a rhinoplasty cost? Well, basically a primary rhinoplasty is definitely cheaper than a secondary because it's less work. But on average, I would say the surgeon's fee runs around $7,000 to $8,000. Then you got to add another $2,000 to $3,000 for the OR time and the anesthesiologist, which puts you in a ballpark figure of around $10,000 for a primary rhinoplasty and a bit more for a secondary. So the main takeaways that I hope you got from this talk is that different noses require different procedures, and it's very important to individualize the nose for any particular face. And during your consultation, we'll take a good look at both your nose and your face and make sure we're on the same page and doing the right thing to try to improve your proportions. If you have problems with nasal breathing or appearance, those are both good reasons to consider the procedure, and when it comes to nasal breathing, we can sometimes get your insurance to cover part of the procedural costs. Lastly, I really feel strongly that your results should look natural. That's an important thing and something I really strive for in every rhinoplasty I do. And besides that, I want you to know that you can combine the procedure with other facial aesthetic procedures. And I'm going to close with that. In this patient that came in for a functional rhinoplasty, she had trouble breathing through her nose. We got that covered with insurance, and then she also wanted to face a neck lift, and we're able to do that for her and give her a nice result. All right, so thank you for listening. If you have any more questions, please visit the website at drjasonplasticsurgery.com or come in for a consultation. You can call us at 310-825-8827. We look forward to seeing you. Thanks so much.